The neck is really sensitive, and a lot of people don't understand why they have so many issues in their body, um, especially around like shoulders or head. My partner was complaining last weekend like of headaches, and so on Sunday morning we actually spent probably about 45 minutes, and I was doing neck work. And guess what happened to the headaches? Ta-da! And he always gives me this kind of look after. What did you do? I don't believe you. I don't believe your hocus pocus. But when we look at like the neck, there's so much going on. And if you just look at like what the neck can do as I'm talking, you know, kind of just moving your neck, like just think about that for like from a creation standpoint, like the creator somehow endowed us with this amazing ability to do all of this with our neck. And I don't know if you've had a similar experience to me, but I've been in the shower where I will, I've reached up for the shampoo bottle and then all of a sudden my whole neck will seize up, and I'm sure that if that hasn't happened yet, Alex, it will happen. Something to look forward to. So he's so young, nothing happens to you when you're younger than 22. So there's a lot going on, and I don't know if you guys know this. This is an interesting fact to remember. 80% of your nerves are in your neck. 80% of the nerves are in the neck. And so it's no wonder why that we feel a lot of tension when our neck goes out. I can speak for myself and say that when my neck has gone out, that I just really feel like my whole body is unglued and my whole life, like everything is all of a sudden about my neck. Same thing with the back. It is fair to say that too, definitely with lower back, when people's lower backs go out. So today we're going to look at the neck, and we're going to kind of try and do three things. The first thing is to put some natural curve in the neck. And this is like something that's really interesting. It's kind of a topic I like to unpack over a few glasses of wine at night. That that in yoga, we often say to people like, don't arch your neck, right? But actually the neck is supposed to arch like that. Like the curve of the neck, it's a C curve, it's supposed to go like that. And there, that's better. So there's supposed to be a curve here. And it was really interesting. A couple of years ago, I had an x-ray done on my lumbar spine and my cervical spine. And this was actually like that. Now, do you think that that might contribute to some neck problems? So one of the very first things we're actually going to do in the sequence for today is start putting some curve back into the neck in a very gentle way. And what I teach you guys today is something that you can do anytime, especially if you're doing Shavasana. It's a great time to do it. We're actually going to do it in reverse and work on putting that curve back in through a technique called spinal molding. So we really want to start putting that curve into the spine, into the neck. The other thing that we want to do is strengthen the muscles of the neck. The neck, this is like a 10-pound, piece of mass that's just sitting here. And, like with a baby, you have to support the head because none of the muscles in the neck are developed. And the fact of the matter is a lot of our muscles in our neck are asleep. And my friend Nate over here, we're both on our computers a lot, sitting like this. And what is that doing? Essentially is it's turning off muscles in the neck and then weakening them. And then we wonder why we end up having problems in our neck later on. And it's kind of interesting to me that we think about, like, if you go online and you see like how to get rid of neck pain, there's actually a lot online about getting rid of neck pain by strengthening the extensor muscles, but there's not a lot online about strengthening the front muscles. And if you look at a lot of exercises, there's not a lot of exercises that actually work on, even in yoga, strengthening these muscles. It's really hard to do. So today I'm going to show you a really simple and easy hack in how to do that. But just for fun, one of the most important muscles, and you probably never heard of this before unless you're into anatomy, is called the sternocleidomastoid. Everybody say that. Sternocleidomastoid. And I'm going to show you exactly where to feel it. It attaches, well, there's actually two attachments on the clavicle, but the first one is at the sternum. And if you feel like right at jugular notch, there's a bone there, and that's called the manubrium. And just a little laterally, just slightly laterally to it, that's where the sternocleidomastoid attaches to. And the other attachment is if you go to your earlobe, it's not on your earlobe, don't worry. But then if you go just to the base of the neck right here, that's the other attachment. So after we do our curve thing, I'm going to get you guys, we'll start strengthening this muscle, and I will make a point of saying, as we're doing this, bring your fingers to those 2 points. In yoga, works really well with this idea of muscle activation, because what is yoga about? What does your yoga teachers always say? Mind-body connection. And so I believe that the more that you can get your mind connected to what we're doing, the more powerful it becomes. So we really want to strengthen it. And then the last thing that we want to do here is to take the pressure off the nervous system. When spine, and this is actually a really good example for the cervical spine, but you can kind of see here this little red thing sticking out. This is an example of a herniated disc. And what is that disc doing? It's pressing into a nerve. And so we have sometimes, especially in our neck, and I guarantee you, a lot of people, more than you would think, have these kind of issues up in their neck. Anybody who has tingling down the arms, what is one of the number one complaints with people in yoga? Wrist pain. I had 4 girls in my last class that were dealing with severe wrist issues, and then tingling down the arm, and then shoulder issues. A lot of that can be traced to disc herniation in the neck. So one of the things that we want to do is get pressure off of the nervous system. It literally pressure. I'm not being hyperbolic there. I'm literally meaning get the discs off of there. How do we do that? We do that through extension, properly extending the spine and also moving the spine. And sometimes it's a little difficult to do that. I think one of the mistakes that sometimes yoga teachers say is like, don't stress your neck out. But sometimes we have to start moving our neck to get those muscles stronger, but also to get that movement happening in the discs. Okay, so what we're going to do first is one of my favorite yoga postures, and it's called Sphinx pose. Now, you're probably wondering why we're doing Sphinx, since we're going to be starting with the neck. And one of the reasons why, or the simple reason why, is what do you notice about the lumbar spine and the cervical spine? They're both curving. They both mimic each other a lot. When I got that x-ray for my neck and it was really flat, one of the things I noticed was how flat my lumbar spine was. So we actually want to get some curve, and this kind of curve, or hanging out in this curve, will start to allow the disc to start being sucked back into the vertebrae. So that's where we're going to start today. So what I'd like you to do is just come onto your yoga mats and literally come and hang out. This is also called pillow talk pose. So we can have a nice girlfriend talk here. Paint our toenails and But in all seriousness, we're going to hang out here for a couple of minutes. I'm actually going to time it. And as you're hanging out here, turn your attention to your lumbar spine. I invite you to close your eyes because there's really nothing to look at except the floor. But just close your eyes, jiggle your glutes a little bit. And take a couple of deep breaths. And this may be a little challenging for some of you because your lower back muscles are not used to shortening in this way. And, it may feel okay now, and then after about 45 seconds, a minute, 2 minutes, it may start to kind of have some sensation there, and it's not necessarily a bad thing. Now, I don't want you to try and exaggerate it at this moment. So don't try to go further into your curve. Just allow it to relax, allow it to just be, and see if you can actually send some breath into the lumbar spine. So breathe so deeply that you can feel the breath touching all the vertebrae in your lower back. So just a interesting story that you guys met Allison today. Allison, our soap lady, and Allison had severe sciatic pain going down her leg. And so one day I talked to her and I said, Allison, you need to start practicing Sphinx pose. And a month later, she contacted me and she said, all my pain is gone. And then she started telling me about how she would do Sphinx pose while she was surfing, riding out there. She says, yeah, I'm getting my Sphinx pose in. But this is a really great pose. So if you know anybody who's suffering from sciatica, get them doing this pose. Anybody who's got nerve pain in their legs, which is a huge problem. It's a lot bigger of a problem than you might think. Get them doing Sphinx pose. So let's take about 5 to 8 more breaths, long, deep breaths. And see if you can begin to extend the quality of your breathing. So breathe in a little bit more deeply. Breathe in maybe a little bit longer on the inhale and therefore a little longer on the exhale. Very good. Inhaling deeply and exhaling deeply. Okay. So what I would like you to do is you're going to take some yoga mats. I'm sorry, some blankets. And there's a couple of ways that you can set this up, but I think the simplest way is if you have a blanket, fold it in half and just put it there, put it down here. Now, I like to set up 2 blankets. And another way to do this, if you want to experiment with it, is actually to roll up a blanket like this. So you can do 1, or you could do 2. I actually I'm feeling a little adventurous today. I'm going to do 2. and see how that is. Now, this is going to be, if you did this and you're not used to it, this could be way too much for some of you. So, but you decide. We're going to hang out here for a few minutes. Like, it's not going to be a short time. It's going to be a little bit of a longer time. So we had that one, and then we have one for our neck. And the one for our neck, and that's actually one of the thick blankets. I'm going to use one of the thinner blankets. The one for the neck, I like to kind of open it up like this. And then just kind of roll it up. Now, you don't roll it up that much, okay? So, and you can also kind of play with this a little bit. So, if you roll it up too much, you can always come back and unroll it. Don't roll it up in a sloppy way. Like, just don't like something like this. Roll it up in a firm way so that it's organized. Because remember, your neck's going to be there. Remember that 80% of your body's nerves are in your neck. So you want it to be nice. If this is your first time doing this, maybe do it a little bit less, okay? This technique that I'm showing you is a technique that a lot of chiropractors use, by the way. It's called spinal molding. And I can't overemphasize the power of what I'm teaching you. This is worth the price of all the money you paid to come to Blue Osa this week. What you're learning here is going to save your bacon in the future. I'm not exaggerating the slightest bit. What this does to your spine is just magical. And it will, what my chiropractor has told me is that it actually starts to rewire your nervous system because your nervous system is used to this. And what this does is it starts to rewire your nervous system to do this. And if you can do this with the other things that I'm going to teach you today, it's going to really set you up well in life. So when you're coming to do this, you lie down, you bring your buttocks right up to this blanket here, and then you kind of lie down like this. Now, as you can see, I'm very high up. So I've been practicing this for a while. I'm used to this. I'm used to the curve in my lumbar spine. Oh my God, it actually feels really good. But this may be too much energy for some of you. This may be too much sensation. So if it is, you can always, unroll it and then come back into it. Okay? And then with this one here, this one for the neck is going to be the same thing. I'm going to bring this underneath the neck. Just like that. And like I said, we're going to stay here for a little while. So this is a really good opportunity to just relax and breathe in. And breathe out. Feel the rising and falling of your navel center. Sometimes as I'm doing this pose, the most simplest thing I'll do when I'm doing this pose is just do Savasana. The prescription is 18 minutes. We're not going to do it 18 minutes today. We'll do it for about 10. But as you're doing this pose, allow yourself to really relax. And so you can do different relaxation techniques here. You can, if you know it, 61 point, you can also systematically go through the different parts of your body and relax them. You can do tension release exercises. All of it is good. I made a comment earlier about relieving some of the pressure on the nervous system. This pose, this very simple pose, actually starts to release that tension, release that pressure. Take a deep breath in through your nose and exhale through your nose. Notice how you feel. Start to bend one knee and then bend the other knee. And gently roll over to the side. Just take your time, there's no rush. Once you roll over to the side, just pause there for a moment. And then slowly start to come up. All right. How was that? You didn't want to come back, did you? All right. So this is a little tricky, this next thing that we're going to do. So, actually, we're going to use the strap next, and then we'll do the blankets. So what I'd like you to do is to get your strap. This is, in fairness, this is actually better to use one of those bands, I guess those kind of workout bands. You know, like those TheraBands that you see these big bulky guys using. Okay, yeah. So it's better to actually use that, but you can use this in a pinch. And so, but what I want you to do is, as we're doing this, to make sure that you set yourself up so that your lumbar spine is in extension. Okay, so have your buttocks out a little bit. If you want to sit cross-legged, it's fine. Just prop yourself up. We're not going to stay here long. This is going to be like a minute or so, not too long. But what I want you to do is to bring the strap on your neck just above C7. So C7 is that vertebrae that sticks out. So don't let the strap be on that bone, a little bit higher. And all you're going to do is hold the strap out like this. Pull gently, not with that much pressure. But pull gently and let your head come all the way back. And then come back to neutral. And then do it again. We'll do it a couple of times. So pull your neck back. And then come back to neutral. And then pull your head back, not your neck. Pull your head back. And just come back to neutral. And again. And back to neutral. And again. Again, make sure that you've got some curve in the lumbar spine. And then back to neutral. And again. Inhale deeply. And come back to neutral. Exhale. And inhale. And exhale. Good. That's good enough. As I mentioned earlier, it's nicer to use the bands with this than a yoga strap, but a yoga strap works well enough for that. Again, if you have somebody, somebody who's got really bad neck issues, that is a golden exercise. The next thing that we're going to do here is we're going to create a little bit of a table, if you will, or a bench with our blankets and blocks. So put 2 blocks and then put some folded blankets on top of it. And make sure it's stable. So I put 2 blocks, 3 blankets, and I could even go for 4. Okay. And if that, by the way, if that doesn't feel secure, take the blocks out. Like if you just don't feel like it's secure enough. And what you're going to start to do is I want you to come and just lie with your head over the blankets and let your head drop. Okay? And what you're going to do first is you're going to lift the head up. Now, I would normally say as high as you can, but if this is new for you, going and pushing your head up with all that you've got can actually cause more problems, and then relax down. So we don't hold it that long. And then lift up. So go to a comfortable place. In muscle activation therapy, one of the things that we talk about is less is more. So don't feel like you have to be like, lifting up like that. Relax down and lift up. As we're doing this, you might start to notice a couple of things. One is that your range of motion increases so that maybe you can lift up a little higher each time. As we're also doing this, don't lift your chest. So we're just working on cervical extension. We're not working on thoracic extension. And relax down. Also, when you say relax down and lift up, when we say relax down, don't just let your head drop. Slowly lower it so that you can eccentrically strengthen the extensor muscles. And relax down. And lift up. And relax down. Okay, now this time you're going to lift up. Again, I'm going to say as high as you can, but it may not be as high as you can. That's fine. And then turn your head to the right and lift up again a little higher. So again, you're working within your own capacity. Really allow your chest to relax here, Nate, as much as you can. And just lifting the head and then slowly relax down. And lift up first. And then turn the neck to the right. Turn the head to the right, I'm sorry. Turn the head to the right. Again, be gentle here. You are, even if you don't go to your full capacity, you're strengthening those muscles. And then relax down. And lift up. And then turn the head. And then relax down. And lift up. And then turn your head. Again, being gentle with your neck to a degree where you're not causing more stress. We don't want to do that, but we also want to very gently work these muscles. And so by turning the neck, we're shortening the rotator muscles and slowly relax down. By lifting the head up, we're shortening the extensor muscles. By turning the neck to the right, the head to the right, we're shortening the rotator muscles. And relax down. And then lift up. And then turn to the left now. So you're coming into extension with rotation. And relax down. And lift the head up. And turn to the left. And relax down. Lift the head up. And turn the head to the left. Once you've turned the head to the left, see if you can actually lift the head just a smidget more. And relax down. Lift the head up. And then turn the head. And then come on down. Lift the head up. And then turn the head. See if you can lift up a little bit more while turning. And relax down. We'll do it one more time. Lift the head up. And then turn the head. Alrighty. So, come on up and then just sit side saddle with your things. Does somebody have a question? I thought I heard somebody say something. Now, one of the things that I wanted just to say here, and we're going to see this in a moment here, is you might ask yourself the question, why don't you just use gravity to kind of lengthen the neck? But what we're actually trying to do is strengthen the muscles. So we go against gravity and then we hold it there and those muscles start to contract and we improve their ability to contract properly. Some of you are going to notice a big difference in your neck tomorrow. Okay, sitting side saddle, you just come over to the side. And it's a little tricky. It's better to do this like on a bench, when you're bench pressing. I do this a lot I have a special bench. You can also do this on a massage table, but this is okay. Let your head slowly come all the way over to the side. Extend the right arm, or extend the arm on the upper arm, turn the palm up. And then very slowly start to bring your ear towards that upper shoulder. So bring the upper ear to the upper shoulder. And then slowly lower the head. Don't allow the head to drop. Don't let gravity start to pull your head, and then slowly come back up. Again, you're pulling that ear towards that shoulder. I'm sorry, you're pulling your head towards your shoulder, and then slowly come back down. You're bringing your ear up to that shoulder, and then come on back up. And then slowly down. And come back up. Some of you might notice a little popping. Sometimes some of the tissue releases. Sometimes the vertebrae and then release down slowly. Sometimes the vertebrae starts to come into alignment. Don't force anything to happen. If it happens, just go, that was interesting. And then release back down. Do it 2 more times. Come on back up. And hold. 2, 3, 4, 5, 6. And then come back down. And come back up. And come back down. Good. Okay, and then come back up. And this time we're going to turn around and do it the other way, the other side. So sitting side saddle. Turn the upper palm or the arm, like do an external rotation of that bicep so the palm turns upwards. Allow the head just to hang for just a moment. And then slowly start to bring that ear to that shoulder. And then we hold it. and then slowly back down. There's a muscle, and then come back up. There's a muscle in the neck called the multifidus. One of the main jobs of the multifidus is that it's a side bender. So it's this muscle that's responsible for this movement, and then slowly back down. And come back up. But the multifidus is also one of these muscles that really supports the stability of the neck. So this is a great way to begin to strengthen the multifidus, really hard muscle to strengthen. And then back down. You can think about how many movements you do in your daily life and then come back up that are like this. Probably not a lot. And because a lot of us have pain in our neck and then come back down and come back up. Because so many of us have pain in our neck, we actually restrict movement, through habit, through compensation. So what we're doing here is we're actually creating really nice supported neck movements and then back down and come back up. Last one. Bring the ear closer to the shoulder and relax and then come and sit up. Alrighty. So now we're going to start working on the neck flexor. So you're going to lie back and just allow your head to come all the way off. So you want, again, around that C7, T1 vertebrae to be on the mat or on the blocks, and then you're going to just allow the head to come off. So my whole spine is actually on the blankets right now. Alrighty, so I promised you're going to feel the sternocleidomastoid. So come up halfway. Bring your finger to that clavicle notch. You might already start to feel it popping out. That's the sternocleidomastoid. Turn your head a little to the right, just a little bit, like 10, well, about, just pulling it out of my brain. It's actually turn the head about 45 degrees to the right and then lift up 45 degrees. Do you guys feel that muscle? Yeah. And then relax down. And then come on up halfway, turn 45 degrees, come on up halfway again. And then relax down. And this is coming down, by the way. If you do it in a controlled way, really start to support, again, that extension in the neck. And then come on up halfway, turn, and then come on up halfway. And come back down. And now we're going to do the other side. So if you want to switch hands, come on up a bit, turn, and then come on up halfway. See if you can actually trace the sternocleidomastoid to the mastoid. So find the muscle, find the earlobe, and then come underneath the earlobe. See if you can feel that muscle contracting, and then come back down. So one of the things I neglected to mention, come on up halfway, turn a little bit, come on up level, and then turn, and then come on up halfway. Is that I was asking my chiropractor one day, I said, Dr. Kais, what is the most important neck muscle? And he actually said the sternocleidomastoid. And come back down. And then come on up halfway, turn halfway, and then come on up a little bit more. And then come on down. We'll do it one more time. And then come on up a bit, turn, come on up. And then relax down. Okay, we're going to do something a little different. So come on, let your head relax for a moment. And then bring your chin up to your chest. And then turn your head all the way to the right. Bring your head back to neutral, and then let the head relax down. Bring the chin up to the chest, turn to the right. And come back down. And lift the head all the way up. Turn the head to the right. And relax down. And then we'll do it to the left. Bring the head all the way up. And turn to the left. And then come all the way down. Come on all the way up. Turn to the left. And then come all the way down. And we'll do it one more time. Come on all the way up. And turn to the left. And then come on all the way down. And then come just off of your little makeshift table and just sit up straight for a moment and just notice how you feel. It's very interesting. I don't know about you, but I'm noticing I'm sitting up a lot straighter. And we haven't even worked on the whole body. We've only worked on the neck. So that's kind of interesting. Okay, let's move the props over to the side. We're going to do a few things here. The first thing we're going to do is I want you to come onto your back. And if you want to just watch me for a second, it's a little bit tricky. It's not that tricky, but you may just want to just see this. So you're going to turn your head as far as you can to the one side. I'm going to say the right. We'll start with the right. And then we're going to bring our head back towards the other shoulder. So think about the back of the head coming towards that shoulder. Okay? So coming onto your back. I have my knees bent, by the way. You can bend your knees or straighten the legs. It really doesn't matter. I like having my knees bent. So turn your head to the right and then slide the back of your head towards the left shoulder and just hold it there. And then come on out and relax. Turn your head to the right and then slide your head back. And then come on back and relax. And then turn your head to the right and slide your head back towards that left shoulder. Breathe in, breathe out, and then come back and relax. Good, let's do the other side now. You're going to turn the head to the left and then slide your head back. I don't know about you guys, but I feel a difference on this side. I do not have as much range of motion. And then come back out and relax. So just kind of, you'll notice that as we're doing some of these things that one side doesn't feel as it has the same amount of range of motion. Turn your head to the left and then bring the back of your head to that right shoulder. And then relax. Come back to neutral. Turn your head to the left and then bring the back of your head to that shoulder. And then come on out and relax. Turn the head to the left. And then bring the back of your head to that shoulder. And then come on out and relax. Take a couple of deep breaths here. Breathe in deeply. And exhale deeply. Right where you are, please turn around and come onto your stomachs. Okay, so what we're going to do next is some strengthening exercises for some of the muscles that support the shoulder blade and also the neck muscles. Okay, so right up until now, we've been really working and isolating the neck muscles. Now we're going to focus on working some of the muscles that support the neck and shoulder blades. So the first one we're going to do is on the serratus. I'm going to lift my head up a bit just because I don't want the microphone to be hitting the floor. But I want your head, the top of your head or the forehead to be resting on the floor. So it'll look like this. Okay? Then lift your arms up as high as you can. Now keep your arms straight as you're doing this. Don't let the elbows bend. And you don't really need to do much with the shoulders. Don't reach forward with the hands, but I also don't want you to pull or retract the shoulder blades. So keep the arms in neutral. And then from here, lift the arms up. And relax down. And lift the arms up. And relax the arms down. And lift the arms up. Now relax your glutes. Relax your back muscles. Relax your legs and then relax down the arms. So don't use any other part of your body here. Just only lift the arms. Don't tense your neck. Don't tense anything. Just lift the arms. So lift the arms when you're ready. And relax down. And lift the arms. And then relax down. And lift the arms. And relax down. Good. Now bring the arms out to the sides, make a T. Again, everything is relaxed. Do an inner rotation of the arms and shrug your shoulders up towards your ears, but gently, of course. And then lift the arms up. And relax down. And lift the arms up. Kind of shrug the shoulders a little bit. And down. And lift the arms up. And relax down. And lift the arms up. And relax down. And lift the arms up. And relax down. Good. Bring your hands behind your back on your sacrum. Then lift the chest and swing the right arm forward. And lift the chest up as high as you can. And then bring the right arm back and turn the right ear to the floor. On the next inhale, swing the left arm forward and lift up as high as you can. And then swing the arm back and bring the left ear to the floor. So let's move with the breath here. So inhale, right arm forward, lift up as high as you can. And exhale, come down and right ear to the floor. Swing the left arm forward. Inhale, lift up. Exhale, swing the left arm back and left ear to the floor. Inhale, swing the right arm forward. Now lift the left leg up as you're doing this. Exhale, swing the right arm back and lower the leg down as you lower your right ear to the floor. Swing the left arm forward and right leg up. And swing the left arm back as you lower the left ear to the floor. Inhale, bring the right arm forward, lift the left leg up. Lift the chest up as high as you can. And exhale, swing the right arm back and lower the leg down. Inhale, swing the left arm forward, right leg up, lift the chest up as high as you can. Higher, and then come down and left ear to the floor. Inhale, swing the right arm forward, left leg up. Exhale, right ear to the floor, left leg down. Inhale, left arm forward, right leg up. Come up a little higher, and exhale, come down. Okay, listen carefully. You're going to swing both arms forward, lift the chest as high as you can. Have the arms at 45 degrees. Hold it there. Lift up. Lift up. And then squeeze the elbows. Elbows are level with the shoulders. Lift up. And arch the upper back. Hold it. Hold it. And down. Hallelujah. That's hard. Okay. Arms back. Swing the arms forward. Arms at 45 degrees. Lift up. Lift up. Lift up. Arch the upper back. Arch the upper back. Don't squeeze your glutes here. I know. And come on down. That was really funny. If you're squeezing your glutes, you're not using the upper back muscles. I'm sorry, you're compensating. So I want you guys to isolate the upper back muscles as much as you can. Okay, do it a couple more times. Swing the arms forward, 45 degrees out. Lift up. And then squeeze the elbows. Squeeze the elbows. Relax the glutes. Squeeze. Relax the glutes. And down. Are your glutes relaxed? Okay, swing the arms forward. Lift up. Lift up. And then squeeze the elbows back. Lift up higher. Higher. And down. We'll just do it one more time. You guys with me? Make it count. Bring the arms forward. Lift up. Lift up. And squeeze. And down. Oh my God. Let's stay there for a moment. Inhale deeply. And exhale deeply. Inhale deeply. And exhale deeply. Inhale deeply. And exhale deeply. Inhaling and exhaling. All right, let's come and sit up. I want to invite you to come and sit on 2 blankets, at least. Yeah. Those of you who've been studying with me know that this is an Aaron favorite. But I want to just speak to something really quickly because there's people watching this or haven't studied with me before and don't know about applied yoga anatomy and what we're doing here. Applied yoga anatomy and muscle activation looks at how do we actively get a muscle to start working properly. So if I turn my body like this, if I turn my torso more accurately, I'm actively using my muscles. Yes, you guys got that right? Turn your torso. You can feel muscles contracting as you do that. Yes? Okay. If I don't do this, don't do what I'm going to do because I'm not going to really do it. But if I take my hands and use my hands to torque my torso, that is passively moving my torso. So, what we're looking to do from this perspective is to actually move away from passive movement and move more into active movement. When we start to passively move, we bypass the brain and the brain starts to disconnect from the muscles. And we proved that the other day with hip flexion. Remember, we hugged the knees into the chest and we saw we had no strength. So, while here, bring just the hands to the shoulders. And normally I teach this to really lift up. I'm not going to actually do that so much today. But I want you to just twist it. But the other thing that's really important is to make sure your lumbar spine is arched here. Okay? So keep the lumbar spine arched. Turn to your right as much as you can. And I want you to turn your head as much as you can to your right as well. So actually, let your head look over. Stay there for a moment. Take your chin to your left shoulder. And then back to your right shoulder. Twist a little more. And then come on out of it. And relax the arms just for a moment. In the Hatha Yoga Pradipika, it talks about twists as being the most potent for spiritual awakening. It says that the serpent power is awakened so much that the prana rises all the way up into the bindu, and the yogi is enlightened. Nice promise. Bring the hands to the shoulders. Twist. Again, working on keeping that arch in your lumbar spine. Take your chin over to your right shoulder. And then slowly to your left shoulder. As far as you can, but without hurting yourself, of course. And then over to your right shoulder. And then come back out and relax. Bring your hands to your shoulders. Lift the chest. Turn over, twist to your right as far as you can. Take your chin over your right shoulder as far as you can, comfortably. And then over to your left shoulder. And then over to your right shoulder. And then come on out. Again, feeling the arch in the lumbar spine. Squeeze the hips into the midline. Take the sides of the belly towards the navel. This time, recross the arms. So recross whatever way you were doing it last time, recross the arms the opposite way. Lift the chest up a bit and then turn to your left this time. And then your chin over to your left shoulder. And then bring your chin over to your right shoulder slowly while twisting. And then back over to your left shoulder. And then relax the hands down. Bring the hands to the shoulders, lift the chest, arch the lumbar spine. Twist to your left. And then chin over to your right shoulder. And then back over to the left shoulder. You might notice some differences. Twist a little bit more between the two sides. Just put a pin in it for your own reference and then come back to center. What we're always looking for in muscle activation, applied yoga anatomy, is looking for discrepancies, for asymmetries between the right and left side. Bring the hands again. Lift up the chest, twist to your left. Twist a little bit more, bring the chin over the left shoulder, and then over to the right shoulder, and then over to the left shoulder. And come back to center. Good. And just pause there for a moment. Okay. And then just come and lie down. So as you're lying in Shavasana, holding your attention in your body, breathing deeply so that the belly expands upwards. You feel the two floating ribs opening up like a clavicle. With the inhalation, it's opening. With exhalation, it's closing. And just see if you can feel or experience or have the intention of all the postures being assimilated in the body, being integrated. Good. Inhale deeply and exhale deeply. Just bring the hands down beside your waist. Bend one knee and bend the other knee. And then with using your muscles, not your hands, pull the knees into the chest. And then inhale, bring the arms over your head and press the heels up to the sky, straightening the legs. And then exhale, bring the knees into the chest and slowly lower the hands down beside your waist. Inhale, press the feet up. Exhale, pull the knees into the chest. See if you can actually lift the pubic bone a little towards the navel. You can feel the lower abs engaged. Inhale, press the heels up. Bring the arms over your head. Exhale, pull the knees into the chest gently. Lift the pubic bone towards the navel. Inhale. We'll do it one more time. Bring the feet up. And exhale. Knees to chest. The hands come down. Good. Let the feet come down to the floor. Slowly roll over to the side and come and sit up for a second. And just sit for just a moment. And feel supported, feel strong. Life's energy flowing through your body effortlessly, easily, with fluidity. Take your right arm or hand, over your heart center and your left over your right. Just repeat this affirmation a few times to yourself silently. I am supported. I am strong. I am supported. I am strong. I am supported. I am strong. The strength of my body carries me effortlessly through this life. The strength of my body carries me effortlessly through this life. The strength of this body carries me effortlessly through this life. Namaste.